I think it will.
Or is it there for window dressing?
No, I think it identifies that we have some serious systems issues in hospitals and other agencies that have to be addressed, that we have to fix to make healthcare safer. The intent is not just on the reporting to the family when there's been a bad outcome. That's only one small piece of it. The bigger picture is how can we make our healthcare system safer so that we avoid injuries that are occurring in today's healthcare system. Hospitals do have tremendously low operating profits, but the government is recognizing that in order to improve the system, we have to give some relief, we have to give some money to make it safer.
And relief in more ways than one, Pat Iyer. Pat Iyer joined us tonight from MedLeague Support Services in Flemington, New Jersey, helping out attorneys, not representing attorneys, but working with plaintiff and defense counsel when it comes to gathering evidence and gathering data, putting cases together in med-mal and personal injury cases. You can contact Pat Iyer, registered nurse and author, at MedLeague Support Services at 908-788-8227. Visit them on the web at medleague.com.
This presentation gives an introduction to nursing home malpractice cases. I will first cover the most frequent reasons why suits are brought against nursing homes. I will then explain dementia and how it affects liability issues and a patient's ability to express pain. The defense of the case was complicated by spoliation of nurses' notes. According to the testimony of the nursing home nurses, entries that were dated earlier in the month were actually written the day the resident died in the hospital. Nurses testified that they were asked to update the chart after the resident was discharged. When the nurses' timesheets were compared to the medical record, there were entries written for days the author of the note did not actually work. This case ended with a $9 million verdict. Here's the medical record from one such case. The record documents the extent of the burns. After extensive skin grafting using donor sites from the resident's legs, her back was still raw. The medical record showed that the nurses in the nursing home were putting mercurochrome on her skin, a chemical that does nothing but color the skin and causes a burning sensation. This woman was so traumatized by her burn and the painful treatment that she exhibited fear whenever anyone came near her and repeatedly said, "Please don't hurt me." In a 2002 Maryland case, a demented resident with a history of self-destructive behavior fell from an unsecured window. He suffered multiple broken bones and internal injuries. The case settled for $1.4 million.
Patricia Iyer is a registered nurse, nursing expert witness, and president of a legal nurse consulting firm in Flemington, New Jersey. Nurse Iyer was the editor of Nursing Home Litigation, Investigation and Case Preparation, published by Lawyers and Judges Publishing Company. She was also the editor of Medical Legal Aspects of Pain and Suffering, published by the same company in 2003. Nurse Iyer is past president of the American Association of Legal Nurse Consultants, a 4,000-member organization.